Welcome to Live Tampa Bay's Link Lunch and Learn webinar. My name is Kelly Rodriguez. I'm the Program and Policy Coordinator with Live Tampa Bay. If you're joining us for the first time, Live Tampa Bay is a coalition of business, faith, and philanthropic leaders who've joined together with traditional frontline professionals to achieve a singular but bold goal to reduce the number of opioid overdose deaths by 50% in 5 years. We seek to accomplish this through a collection of interlocking efforts, including advocacy, education, and collaboration across sectors. The program acknowledges that to combat this crisis, it will take all of our efforts. Today, we're going to discuss how to create housing solutions for people in recovery. We know that housing is one of the largest barriers to sustaining long-term recovery, and that's why today we're going to discuss how the private sector, nonprofits, and funding entities can work together to support people in recovery. We know that housing is a major concern in the Tampa Bay region and across the state. Whether we call it affordable housing, attainable housing, or workforce housing, this is a concern of the chambers of commerce, realtor associations, affordable housing advocates, and municipalities. Lots of people may be thinking, exactly, why have another conversation about attainable housing? Well, for two reasons. The first one is in this conversation, we will not rehash the same old solutions that are proposed at symposium after symposium. Instead, we hope to use these solutions as a springboard into what we hope will be a new conversation on an old topic. And number two, regional data draws a clear correlation between supportive housing for folks in early recovery and retention in recovery. Thus, we need to talk about, if you could put yourself on mute, please. Thank you. Thus, we need to talk about this more specialized section of the housing sector, supportive housing, housing which helps those in early recovery sustain their recovery. Specifically, we'll be discussing how the private, nonprofit, and philanthropic sectors can work together to address the housing crisis and why this is of particular importance to people in recovery. To help us have this conversation, we've invited Amanda Rosado. Amanda is the Chief Strategy Officer for the Florida Housing Coalition. She previously served as the coalition's Ending Homelessness Team Director. She's also the HUD Technical Assistance Provider to continuums of care throughout Florida. And prior to working with the coalition, Amanda worked in various homeless and housing programs, including rapid rehousing, permanent supportive housing, emergency shelter outreach, and behavioral health. As a strong advocate for housing first and recovery-oriented systems of care, she's passionate about utilizing evidence-based practices and providing effective interventions to work with some of the most vulnerable populations. Amanda holds a master's degree in social work. Welcome, Amanda, and take it away.
All right. Thank you so much for the introduction, Kelly. Happy to be here. I have the pleasure today of introducing and talking to our panelists about creating housing solutions for people in recovery. So we're going to discuss best practices for providing housing and how different sectors can really work together to support people in recovery. So our first panelist is Patrick Slattery. He is the owner and operator of Real Recovery Sober Living. They're the largest provider of recovery residences in the state of Florida. The Real Recovery program has 380 beds for men across 7 locations in the greater Tampa Bay area. Since starting Real Recovery in 2016, Patrick has obtained a lot of certifications. So here we go. Certified Recovery Residence Administrator, Certified Recovery Support Specialist, Certified Recovery Coach, and Certified Event Interventionist. So Patrick has been in recovery himself since 2015 and was once a resident at one of the sober residences he now operates. His strong foundation in recovery informs his approach and passion for the work he does. Patrick's philosophy with men in early sobriety comes down to instilling the principles of the 12 steps, along with a direct, concise, polite attitude. Welcome, Patrick. Our next panelist, Michael Allen, is the founder and president of Revital Development Group and leads Revital's efforts and strategic plans, including developing and acquiring diverse multifamily housing projects throughout Florida, with a specialty and focus on affordable and workforce housing. Prior to forming Revital, Michael Allen was the executive vice president and board member of a Tampa, Florida-based 501c3 organization and managing director of a public benefit corporation, B Corp, where he was responsible for leading the company's affordable housing development platform, as well as the continued growth of the firm's multifamily and mixed-use development pipeline. And that included all aspects of the real estate development process from initial conception through construction to lease up and stabilization. Previously, as the former vice president of development and opportunistic investments at Aileron Investment Management, a Tampa-based investment banking and real estate development firm. He was a lead component to the development of over 1,000 multifamily units throughout Lee County, Florida. While working in collaboration with community stakeholders, projects under Michael's management have received development incentives, including TIF, nutrient bank credits, waived and deferred impacted fees, waived and reduced permit fees, NSP, homes, CDBG, and several others. I feel like that just gives you a taste of how many different programs there are out there with all those acronyms. Michael attended Montclair State University in New Jersey and currently resides in Tampa with his wife and 2 daughters. He's actively involved in local, statewide, and national advocacy efforts and is a member of the Lee County Attainable Housing Coalition. Mr. Allen has over 17 years of diversified real estate development and finance experience. Awesome. Welcome. Our third panelist, Antonio Bird, joined the Tampa Hillsborough Homeless Initiative as the Chief Operating Officer in August 2014. With over 15 years as an abolitionist for eradicating homelessness, love that, and generational poverty, he is instrumental in developing and implementing innovative strategies and initiatives. He oversees the governance, development, and coordination of the local continuum of care network. Previously, he served the city of St. Louis, Missouri for 8 years as a contract compliance officer and program manager of the Homeless Services Division. While working closely with Antoinette Hayes Triplett, he was responsible for implementing and co-developing innovative strategies towards decreasing and ending homelessness locally and regionally, such as Project Homeless Connect, the St. Louis What's Right in the Region Award-winning initiative, the Beach Project, and Operation Reveal STL, just to name a few. Antonio was also instrumental in securing over $80 million in local, state, and federal grant funding for the City of St. Louis Continuum of Care. And we are lucky to have Antonio and Antoinette leading THHI in this community. So welcome, panelists. All right, so as mentioned earlier, housing plays an important role in one's recovery. However, it can also be a barrier to sustaining recovery. So for the first half of our discussion, I'm going to share some best practices from the Florida Housing Coalition, but really these are national best practices. And we're going to hear how our panelists are implementing these best practices. And then the second half will be followed by our panelists explaining their programs and what supports they need to increase access to housing. All right, so I'm going to just go over and talk about housing stability, solutions, and recovery, just a real kind of quick overview. You can go to the next slide. So we cannot talk about housing without talking about housing affordability. It's the first thing that comes up in every community in Florida when we come in and we start talking about homelessness and workforce, and the immediate thing is we don't have enough affordable housing in Florida. So on the next slide, I just kind of want to show the gap here. So this is from our annual Home Matters report. You can go to our website and you can actually break down county by county and see your area, what the affordability is, and the severe house cost burden. So I will say in the Hillsborough County area, people earning between 0 and 30% of area median income are at about a 79% severe cost burden, meaning that they're paying over 50% of their income towards their rent. So we see here, if we're looking at a basic family of four to meet their needs, and this is 2020 data, the parents would need to earn a combined wage of $34.76 per hour. If we're looking at one bedroom rental over here in those right squares, we're seeing at minimum wage, people would need to work 86 hours a week to afford a one bedroom rental house. And this is in the overall aggregate information for the state of Florida, or that equates to 2.2 full-time jobs. So you can go on to the next slide. It's just a little bit about how dire things are. So if you're wondering in your area, how many available and affordable units are there? Well, you have about 26 available and affordable units for every 100 households. So what does that mean? You have a significant deficit. And of course, people with the lowest incomes are always impacted the most when it comes to housing affordability. So I say that because sometimes the conversation in a lot of communities is, people making 80% of area median income, or 100% or 120%, but we can't forget about the most cost burden people in our community that can't even afford the affordable housing that's being built. So we have an extreme deficit here for people in those lowest incomes. So you can go on to the next slide. So what does this mean, in the context of homelessness? So when we're looking at housing instability, it's no surprise that people experiencing homelessness are at the most risk of and have the most severe housing instability. So when we're looking at the state of Florida and people reporting substance use, so I want to put a little kind of context with this. Once a year, your community does a point in time count. So for that one night, they count up how many people are sheltered, how many people are in transitional housing, how many people are unsheltered, and they really rely on volunteers, outreach, and COC staff to try to get these accurate numbers. One of the things that people can self-report is if they have substance use or mental health or domestic violence. There's all these different categories they can report. So this is a self-report number, and HUD uses the terminology chronic substance abuse. And when they say that, what they mean is that this is long-term, indefinite, and that it will impair the person's ability to live independently. So I just wanted to kind of create that context because this is, we know, an underreport, just the number of people and how many people are reporting substance use. We know that's a higher number, but it's really hard to get accurate data on that exact number. So on the next slide, housing is the platform for recovery. So housing comes first. This should go without saying, but honestly, programs have been designed for years that are kind of backwards to this philosophy, showing that you need to attain sobriety, you need to attain some, clean time, you need, all of these different things before you get into housing. But what all the research is showing us now is that if someone doesn't know where they're sleeping that night and they don't have that stability of home, the likelihood of them becoming, seeking treatment and prioritizing sobriety is really low. So to give people the best opportunity to get into recovery, we have to start with that housing. On the next slide, what does that look like, right? It's not just housing. So sometimes people hear housing first and they think, oh, you're just talking about, just drop people into housing and that's it. And that's totally not it. Housing first, as a best practice, comes with a lot of intense support. Number one, connection to communities. We know that in recovery, one of the most critical things is getting out of isolation. It's being able to share your story. It's, forming that community around you. Access to income, whether that's, employment or disability or some other kind of benefit, it's critical. Connecting people to recovery, whatever that looks like for them. And then that support. And ultimately, the goal, right, is to increase quality of life, and housing does that. So next, I just want to review some affordable housing options. So I'm going to drop some links in the chat a little later on, but when we talk about housing and recovery, I kind of categorize it into these three things when we're talking about housing with support. So one is recovery housing, and this is kind of your traditional, maybe transitional housing model. This is, people don't have a lease in this model. You're usually signing an agreement. You're coming into a program where sobriety is required. And so, we would call this a sober living environment or recovery house or, transitional housing. The next is rental assistance, and this usually is set aside for people who are experiencing literal homelessness or at risk of homelessness. And we also saw that this past year, the emergency rental assistance, which served a much broader group of people. What we found is that people are in financial crisis, and when people are in financial crisis, that can put them at risk of homelessness. And people in recovery or even out of recovery who become homeless then are at greater risk of using substances. And it becomes exacerbated during homelessness. So this short-term rental assistance, getting someone caught up, getting someone into housing and paying their rent for a year or two, this is incredibly important. And also the supportive services should really be tailored to each household. And then we have supportive housing, this more intense category where we're looking at people who do have chronic substance use disorders, maybe co-occurring disorders, and who have been experiencing homelessness for long lengths of time. And those folks need really intense support. They need affordable housing long-term, and they need intensive case management long-term. Not to say that they'll never graduate out of that, but that's just to say in that point of time, we are prioritizing the most intense supports for those folks. All right. So that leads us into our panelist discussion here. And I've kind of laid out 3 different best practices for the panelists to discuss today. So this first best practice here is low barrier housing. So what do we mean by that? So here's what I mean by that. One is screening people in, not out. So when someone is coming in, when someone is in recovery, or even prior to joining recovery, and they do not have housing, the last thing we want to do is screen that person out of housing, right? We want to say, you know what? We want to take people who actually have the highest barriers and the most things on this checklist, and we want to prioritize those folks for housing. Why? Because we know that folks who have poor health, poor mental health, and substance use disorders are at a greater risk of dying on the street. They just, in general, have less length of time. And so we want to make sure that those folks are getting prioritized for housing, right? Not screened out. So active substance use should not be a barrier to entry. Obviously, for sober living environments, that's different. But for our other housing options like rental assistance, permanent supportive housing, things like that, we don't want to screen people out. And the focus here is on harm reduction, right? So we're not just putting people in housing and leaving, but we're using harm reduction practices to try to help people obtain and maintain housing. The other one quick thing about low barrier housing is that often you'll notice this even in like affordable housing complexes, the screening criteria is very stringent in different community type housing developments. And so there has been a lot of movement over the past few years to figure out, how do we not penalize people who are trying to obtain housing for things like criminal history, poor credit, maybe previous evictions. So how do we screen people in and provide support to ensure they have stable tenancy, right? And build up that good rental history. So panelists, I'm going to talk to you about how you are implementing this best practice in the work that you're doing. So Patrick, I'm going to start with you.
Okay, great. Thank you again for having me on. So I think that there needs to be more expansion on respite housing, which is almost a temporary shelter. People who are active in their active in their addiction could go to a safe place, get 3 meals, somewhere safe, and like access to resources, all while avoiding obviously if there's the liability of withdrawals from benzodiazepines and alcohol, there should be more access to hospitalization when that occurs. That expansion on bed availability, that seems to be a big issue. And getting that medical stabilization first. Now there are some drugs that the withdrawals are tough but not lethal. So with respite housing, I know that there's only one right now in Hillsborough County that I'm aware of, but the expansion of that housing, getting that supportive service inside that short-term housing to where they can move on to the next step with the case manager, whether it's getting a psychiatrist just to help with the mental health. And then with the housing component, it really depends on the individual. Do they meet the criteria? Are they willing to go into sober housing? Is there opportunity for them to have supportive, long-term, secure housing? And it kind of comes down to a case-by-case basis. But when it comes to people in their active addiction, I think expansion on hospitalization and crisis units, behavioral health units, and then also respite housing, just having somewhere safe to go in a short period to kind of get stabilized.
Yeah, thank you so much. Michael, I'm curious from your point of view, because as a developer and someone, who's invested a lot into multifamily housing, how are you guys looking at your screening criteria to try to make it more accessible for, folks coming in?
Yeah, good afternoon. Thanks again for having me as well. And so for us, we provide more so the permanent affordable housing, whether it's just truly affordable for 60% of the area median income or below. Some of them incorporate 80% family or seniors, but then we also work with nonprofit partners that provide supportive services and supportive housing as well. So with those, we kind of provide the value of being the developer for the nonprofit. But in terms of the screening process, we often work with local municipalities, local government agents. So oftentimes they have like rental assistance, as you were talking about earlier. So that's one of the risks in some projects we have that are for the demographic that's experienced or previously experienced in homelessness, where they need to have the social services to help them get back into the workforce. And during that time, they don't necessarily have that income. So the local municipality may backstop them. So we're able to cover our debt service that we have on the properties. Oftentimes our debt service may be lower than like a market rate project, because in order to be affordable, whether it's truly just family senior project or a supportive, we need to have some type of significant subsidy, and really significant in today's market with costs. So we're frequently getting funding from Florida Housing Finance Corporation, which is through their competitive process. That includes low-income housing tax credits. So with the federal programs, there's certain restrictions in terms of preference that we can provide in terms of like that pre-screening process. But on the supportive projects that we have, we are working closely with the local government agencies. They're specific, like Human and Veteran Services, for example, or local nonprofits in terms of the individuals that are needing of assistance. And then, as you mentioned before, each community is a little bit different as well and kind of has a specific focus. So all of our family or elder projects have specific programs that are available to the residents free of charge, but then our supportive programs as well. That's where we have nonprofit partners that are either a part of the development and ownership entity that they provide that case management, and or we work with outside partners to work. So, that's going to help our process when we're going through that screening process and make sure that the tenants that we're providing housing for do fit that box that we're able to help. And not just putting somebody in a unit that we're not going to be able to help and achieve a better life moving forward.
Yeah, absolutely. Thank you. Antonio, what about, you're overseeing the entire continuum of care, which has many different types of housing options. How do you get providers on the same page in creating low barrier programs?
Yeah, to make this short-winded, because I can't be long-winded about this, but in a nutshell, THHI is one of 27 continuum of cares in the state of Florida and one of 380 across the country. And each continuum of care is structured somewhat differently. We all carry the same role as the lead agency, meaning convening and fostering community collaboration. But at THHI for the Tampa Hillsborough geographical area, we wear other hats. In terms of one of the hats that we wear is that we are what I like to call an unofficial unified funding agency, meaning a lot of the local, state, and federal dollars come directly through THHI and back out to the community, meaning to the housing service providers and developers. With that being said, it's easy for us to incorporate housing first, low barrier requirements in our community because we make them a requirement for you to receive funding from us. For our RFP process, we developed, I want to say it's probably been about 5 years now, but it's been used all over the country, a housing first low barrier questionnaire. And we initially developed that for the housing service providers, and they receive a score, and that score impacts whether or not they receive, it goes against their total score for receiving funds through the RFP or request for proposal process. And about 3 years ago, we developed one for developers. So even if you are a for-profit or nonprofit developer, in order for your application to be successful, we call that low barrier housing access questionnaire. It's the same analogy, but we ask different questions similar to what Michael spoke about shortly. And so that's kind of what we do in our community, and we encourage all agencies within our continuum of care to follow that housing first, low barrier philosophy in terms of addressing Maslow's hierarchy of need, that if the individual receives their basic needs first, then they're able to be successful in addressing the other needs. And we have an 83% 24-month retention rate in our community. So we have the data to speak to the success of how successful low barrier housing first practices work.
Awesome. I think you bring up a great point, which is, if you're a funder on this call, putting requirements in that say like, hey, if we're going to invest money into, redeveloping this rental development, or we're going to put money into, tax credit units, or help you provide a subsidy in any way, shape, or form, then really looking at, what the program is doing and looking at, screening criteria and looking at how low barrier is it and who's it helping and what is, does that match the need in the community, right? And so those are all like really, really great things you mentioned, Antonio, because there is some accountability there that can be put into place for programs, seeking funding. For the sake of time, I'm going to move on to our next best practice here, which is long-term affordability. we cannot build our way out of the affordable housing crisis right now. So we hear we got to get more units online, got to develop. Absolutely. But we have to retain the affordable housing units that we already have. We lose those when the period of affordability runs out. And that really, impacts communities in a very negative way. So there's long-term affordability on the development side, but also looking at when we provide rental assistance, how long are we providing that for? Are we ensuring that this household isn't just going to receive 6 months of help and then it's going to be a cliff effect where they just drop off? And so looking at what kind of subsidies can be in place to provide that long-term affordability, even in sober living environments. People coming in often out of treatment, they don't have employment right away. They don't have that funding to immediately go in to a sober living environment, but the house, they got to pay rent, right? Got to pay the bills. So everything can't be free. We've got to figure out where those subsidies come from. But helping people who are coming in who have those lower incomes or no income. So, Patrick, I'm going to start with you again on kind of how that looks in recovery housing and what are some challenges or successes you've had with helping folks coming in, with no or low income?
Yeah, I we currently have over 2 dozen different third-party, whether they're foundations, care coordination, any kind of supportive housing initiatives that kind of get funded through different funnels in the state, whether it's the public defender's office or it could be some of these churches and nonprofits that also get together. And what they'll do is they'll help scholarship the first 30, 60 days, sometimes up to 3 months, and rarely up to 6 months. But in that time in my program, you're required to be working, going to school, volunteering, etc. Um, when you're being supported and you're a resident in my program and you're being supported, you're encouraged to get a job. You're actually required to get a job and start saving up and learning how to budget, because they don't have that drop off when the funding runs out, that they have that expectation set forward. And we do weekly, we do bi-weekly, but we try to encourage people over time to start paying monthly. So when they are ready to move out of transitional housing, they are prepared for the real world, where a real landlord wants this money on the first. Otherwise, there'll be an eviction. And so we try to train these guys on how to budget, how to be an adult, how many hours a week do they need, at what hourly rate to kind of set their life up where they can pay the $26 a day to live in sober living, and they can afford their meals, they can afford transportation, and what other supportive services that come along with sober living. For us, they can get a free gym membership, they can get free or discount public transportation. They can actually get free education at any public state college, whether they need to go back for their GED or not. So all of those things are kind of long-term goals that kind of build up to where they can have a sustainable job, that they can, learn how to budget and take care of themselves. But it's that, coming in off of nowhere. We don't take Medicare, so it's really difficult when we just getting someone to come into our program, and having to turn people away that don't have a week's worth of program fees for us is very difficult. So we've been partnering and working with different foundations. We're in talks of working with the opioid money coming down to help support grants and that kind of stuff for guys. But it's a lot of red tape, a lot of hoops to jump through. And for these guys, it's a matter of, I got a day or two to figure it out. They don't have time to wait on all the red tape and see if they qualify. So
Right.
streamline that from our part is probably the hardest part. From our side of things is just having a guy call today. I don't have any funding. I don't know what to do. How can I get in and help? And us navigating and working with whoever we can to kind of support them just in the beginning, just so they can get back on their feet, have a roof over their head and they don't have to worry about that one thing, if I have to sleep outside tonight or not.
Yeah. Thank you. Michael, quickly, I want to just ask you about long-term affordability from a developer standpoint. Do you have a certain goal you're looking at with long-term affordability, and how do you kind of come to those decisions?
Yeah, so it's a good question. So for us, we're not just a developer, we're also an advocate for affordable housing across all the demographics, supportive as well. So one of our largest funding sources is Florida Housing Finance Corporation. So based off of their funding that they have their solicitations for, they'll often have an affordability period that you have to agree to. So, and then in addition to that, as Antonio is talking about, just some of the requirements and restrictions for the funding. Oftentimes we're getting local funds from local governments that they received from federal funding. And I often tell them, most recently, the ARPA funds with the coronavirus, now's your chance, now's your leverage. Developers like myself are certainly having shortfalls with the interest rates and costs going up. So to make these projects move forward, put that long-term affordability in and make it 99 years. I know previously with tax credits it's been 30 years, but that 30 years has gone quickly, and now you're starting to see that affordability fall out. Oftentimes on a local level, you're hearing, which one of my big pet peeves is somebody doing a presentation saying they're doing 140% of the area median income and 10% of their project to get some bonus density or some incentive, but that's often market rate or exceeds market rate in some areas. And then when they get that subsidy, it's maybe a 5, 7, 10-year affordability period, which just puts a short-term Band-Aid on it. So doing those land use restriction agreements as Laura's for long-term 50+ years. I always volunteer 99 years, even if they're 20, just so we can maintain that by the time once, in fact, we ever exit. Another approach that we often do is we'll work with, one I'm breaking ground next month on in Lee County and Cape Coral, where we partnered with the Lee County Housing Authority, and it got a little bit complicated because they didn't own the land initially, but the structure is we're acquiring the land, we put the money up, my firm put the money up, and we're actually selling the land to them at our cost basis for no profit. And they'll own the land wholly, enter into a 99-year ground lease with us for $10 a year. And the reason doing that is just to maintain affordability even after we exit it. So they're a quasi-governmental agency. So you can do the same with community land trusts, local government agencies, nonprofits. So that's an approach that we're doing as well. Just having them wholly own the land, and that kind of controls the future rights and restricts a developer from converting that to market rate. But yeah, that's a big component of our approach to try to maintain permanent affordability on all our projects. So that's our goal.
Yeah, thank you. Love the 99 years. Yeah, we want things in perpetuity. We want that our organization, the Florida Housing Coalition, advocates to Florida Housing Finance Corporation and local governments to say, like, look, you have the funding, you can require this of developers, and it's needed so significantly. So, thank you for that. Thank you to developers who are actually advocating for long-term affordability. That's huge. And we're going to move on to the next best practice. And Antonio, I'd love to get your feedback on that, because supportive services can be really difficult to fund. So a lot of times funding will come out on the housing side or the rental assistance side. But you're finding that people really need intense support services, and the funding just isn't there to close that gap and provide those wraparound services. So the other thing that I just want to mention is recovery does not look the same for everyone. So some people are ready in their journey. I want to seek sobriety. I want to get into a 12-step program. I want to live in a sober living environment. Other people are like, can we just reduce the drinking, to the morning? There's different levels that people are at. And a lot of times we have to take that harm reduction approach until people kind of progress to a different point in their recovery. And that requires good case management and good support services in the community. So Antonio, how do you ensure that those programs, again, going back to your funded agencies, have proper supports in place?
Yeah, thank you for that. and I'll go from the top down. So the biggest thing that we do, as I mentioned, as a funder, is that we put supportive service requirements in our agreements with the housing service provider. Um, Specifically, speaking more so to the amount of the salary that they pay to the case manager or the LCSW. Um, I've been in it for a while now, and I've seen anywhere between a case manager coming out of college making $25,000 to $27,000 a year, and they have to wear all these different hats for the individuals that they are providing case management to, and that is just a disservice not only to the individuals that are receiving the service, but also to the case manager and the organization. And so and I'll just tell you, we put a $40,000 minimum salary amount for all of our case managers in the projects that we fund. So that's the biggest thing, making sure that the case managers are not one paycheck away from also needing homeless resources as well. Again, going back to the Maslow's hierarchy of need. The second piece is we make sure that whenever we are funding housing programs, we include the services with it. When I first got to Tampa Hillsborough back in 2014, and I found that this was kind of a standard across the state, where they were having different grants paying for the support services, and then they'll have a separate grant paying for the housing. And what we started doing is in making sure that it was all inclusive into a particular grant that we go after, or a funding source that we go after, that we can fund those two programs together, because housing and services go hand in hand. We like to say housing is healthcare. So you can't have the housing piece and not have the support services in order to increase one's quality of life. And then the other piece I would say is that we begin to teach our community about leverage. Going back to what Michael was saying, as a developer, like leveraging the amount of funds, the ARPA funds, and making sure that you bring enough leverage to the table where you can set the parameters around even what the agency is willing to do as a program, and you can help them alter their program in a way that meets the needs of the population that you're funding them to serve. The other piece of it also is taking the funding sources and matching them together. So one example I can quickly give you all is that we administer emergency solutions grant funds through the county, Hillsborough County, as well as their public services dollars under their community development block grant money, CDBG. And before, the community used to use both of those funding sources to fund a lot of support services, mostly for emergency shelter. And so when we started administering the ESG dollars, we said, okay, we're going to use all ESG dollars for rapid rehousing in our community. Let's get people into housing, so then we can free up more shelter beds and create more opportunities for individuals to come off the streets. Then I would say about 2 years later, the county felt comfortable and they were pleased with what we were doing with the ESG dollars. They then asked us to start administering the CDBG dollars. And we said, okay, if you want to get the CDBG dollars, continue to get the ESG dollars, we would match the CDBG dollars with it. And so what we did is we took those two funding sources, matched them together. And so we fund the projects for housing and support services, even the emergency shelters. We call that rapid exit from shelter. So the emergency shelters that get that CDBG money, they also have to do housing placement as well. So that's kind of what we do in our community to ensure that the support services are included in the housing initiatives for individuals emerging from homelessness, or even with individuals that do have. Most of our homeless population have some form of substance abuse issue. And so the ideal is to get them into housing and then offer the treatment to them because they're not going to lose their housing. So they can go into treatment for 21 days, even if it's inpatient treatment, and still come out and continue on with their housing stabilization plan and engage with the community, et cetera. So that's just kind of like a short piece of what we do.
Thank you so much. This was all really great. Thank you. We're gonna move on. Kelly's gonna show a video here, so I'm going to turn it back over to her.
Yes, thank you, Amanda. This is an amazing conversation. I'm learning so much. All right, so we're going to watch a quick video of William Atkinson. William is the CEO of Associate Recovery Communities, or ARC. ARC is a transitional living facility located in Pasco and Pinellas counties that serves people in recovery. Will is also a person in long-term recovery, so we are going to hear a little bit of his recovery story, and Parnia is going to play that for us.
I hear no sound.
Yep, there's no sound, you guys.
My name is William Atkinson. I'm a person in long-term recovery, and what that means to me is that I haven't found it necessary to pick up a drink or a drug since February 27th of 2006. I'm lucky. I got this opportunity at a young age when it was obvious that I wasn't doing well. I had the opportunity to go to what I consider to be one of the best treatment centers. I went through Hazelden's Continuum of Care up in Minnesota, which included their fellowship club. They've been in operation since the 1950s, an organically grown group of sober living homes owned and operated by individual proprietors. And so at a young age, I was 19 at the time, I was surrounded by people in recovery who were gas stations, local coffee shops, meeting halls, everywhere. And so I was exposed to a recovery way of life, and I had a safe, supportive environment. It didn't keep me sober. Unfortunately, I had to test the waters a couple of times. Shortly after turning 21, thanks to the support that surrounded me, I haven't found it necessary to pick up a drink or a drug since. I'm 37 today, and I have had an incredibly blessed recovery journey. In 2008, I got the opportunity to move down here to Florida, where I joined the substance use disorder field. I started working at a local treatment center. I was encouraged to pursue my education, which became a bachelor's in human services, a concentration in addictions, and a minor in childhood development. In 2011, opened up the first Florida Association of Recovery Residences accredited sober living programs on the west coast of Florida called Tampa Bay Sober Living. Since opening in 2011, we have grown throughout the Tampa Bay area with over 100 beds, and we have included other programs into our business, becoming the Associate Recovery Communities. I had a roadmap from my early recovery in and around St. Paul, Minnesota, to attempt to recreate here in Florida through providing a sober campus, an opportunity for people to connect with one another through jobs, meeting halls, local fun events, all of those type of community building activities promote the recovery way of life that we're hoping can be shared and progressed from one person to another. All about creating the environment and the safe and supportive space where somebody can rise to the occasion and recreate their life. And for me, all of that comes from personal experience in and around St. Paul, Minnesota, and the Hazelden program that I had the privilege of being a part of. So without safe, supportive environments, I don't believe I would be where I am today. And I am incredibly grateful for all of the opportunities that these safe, supportive environments have shown me. We are developing and maintaining a recovery community organization called Recovery Epicenter Foundation that provides outreach, recovery, peer support, not only to people in sober living homes, but to the larger recovery community in the Tampa Bay region, all based on the concept that I got to experience in St. Paul, Minnesota.
All right, thank you so much, Phil. Oh. And that just kind of gives everything we're talking about here, it gives it a face, right? How somebody overcame their own personal struggle, utilized some of the safe and supportive resources that we're talking about here today, and then healed from that, and then use that to help others. So definitely appreciate your story, Will, and I will send it on back to you, Amanda.
Great, thank you so much. And, kind of talking about support services earlier, peer support is is crucial, in my opinion, when we're talking about recovery. Being able to talk to someone who's been there, who's going through it, who's taking it day by day, just like you are. Like, it is just so important. So that was great. So we're going to move on. We just have about 10 minutes left. So we're going to make this kind of a quick round robin here, to just ask the panelists, you know, like what their challenges are, and kind of where they see solutions lying. Patrick, I'm going to start with you. What do you see as the biggest need as far as men in your program accessing affordable housing, right? Because they're not there forever. They've got to move on to that point. What is the gap? And then what are you seeing as a solution?
Well, I think we talked about it a couple of times, but it's, criminal history, part of the addiction comes along with a lot of felonies. And we've had guys who've had felonies all the way up to violent offenders. So it kind of comes down to, can we lower the bar, and what's the protocol? How do I broadcast that to the guys? Where can I help guide them, and my staff can guide them on where to apply, what that process looks like, and what the usual time frame is, and do they qualify? And so I'd say probably felonies and affordable housing. With the pandemic and with the growth increase in rental market, I'm having trouble guys being able to afford to move out of my program. More than qualified, ready to move out. And during COVID, we eased up on them because of everything. But now, with everything, are we still serving a purpose, being a transitional housing, supporting them in early recovery 2+ years down the road? I don't think so. And so, how can I guide and help them where they don't expose themselves to finding opportunities on Craigslist that may or may not be legitimate? I just had a case yesterday. 2 guys tried to move out on Craigslist ad or whatever. They're both now out of $3,000 that they got scammed out of, that they saved up months to move out. And so these people are really exposed because now they're desperate and they're trying to find something safe, affordable, and legitimate. And it's not that easy. So lowering that bar, and if there's I wish there was and there might be a link or something that I can have on my website where I can help guide guys go to our website and then go through that link and put in their application.
Yeah, it is hard. People get taken advantage of. And, sometimes in the context of homelessness, I hear people say, well, if they would just get a job. And it's like, it's not that simple. Like, even people working full time cannot afford housing right now, on those wages. So it definitely is, a bigger conversation and an issue. Antonio, what would you say? There's a question on here. Do you think there are enough beds available? I can probably answer that and say no. But I'm curious how your group and how you see other nonprofits working together. What does that collaboration look like, and what does success look like in that collaboration?
Yeah, for us, or really any continuum of care is being able to step outside of the box and create partnerships that have not traditionally been established. For example, early on in my tenure at THHI, we began to immediately foster a relationship with our local housing authority, even though we have 2, but primarily the Tampa Housing Authority. And through that relationship, we were able to acquire housing trust vouchers, specifically for individuals emerging from homelessness. And the way we did that is that we went into a HUD application as part of that HUD annual process. 2 projects, we took 20 vouchers, well, it was a total of 40, but 20 for each project, and included that and matched that against the Continuum of Care's vouchers. So 2 projects, 40 vouchers each. And we were able to then bring on 80 new units in the community, leveraging the housing authority vouchers. The other piece is establishing relationships with your local apartment association, that was extremely instrumental for us, especially prior to early days of the pandemic and the housing crisis. But we partner with our local, which is Bay Area Apartment Associations here, and we help bring on 150 new housing opportunities to the continuum of care as a whole. And we call that speed leasing. And so we basically established an event just like speed dating, where the landlords and the clients and the case managers all convene together, and they basically shop around looking at the units virtually, if you will, or pictures of the units, and then they can put in multiple applications without having the fees on hand at that particular point. And then the case manager can then pay the fees, that type of thing, get reimbursed by THHI for those fees, and then those individuals move into the home that they chose. Also assisting the landlords in redesigning their housing policies and procedures to make sure that they don't break any fair housing laws, but that the policies are inclusive of individuals that are receiving subsidies, because a lot of the property manager documents don't include individuals that receive subsidies in place of actual income. So those are just like two big things that we did in our community to foster those types of collaborations around bringing housing units on.
Yeah, you definitely can't have this conversation without talking to the landlords, right? And building, I mean, it's all about the landlords. You've got to figure out, we know that money drives landlords, it's a business. But what are we bringing to the table as far as incentivizing landlords in this market? That has to happen. So, figuring that piece out is so crucial. Thank you. Michael, I'm going to move on to you as a developer. Outside of financing, your biggest need on a project, what is it that developers need, kind of in the context of trying to bring a nonprofit partner in? What are you looking for?
Yeah, for us, it's really, we look to partner with local housing authorities, whether they're bringing in additional vouchers or something along those lines, as Antonio mentioned, but also frequently working with nonprofit providers. So whether it's a supportive project, that development that we're working on, or even just a standard family, we're providing those resident services. So, just our typical family, individual, senior housing. I think in a perfect world, somebody would probably be short-term at Patrick's housing facility. He'd get them prepared to move on. They'd come over, move into, say, one of our communities. They still receive the adult literacy courses and training that would be provided by a nonprofit partner. The employment empowerment to teach them how to resume and conduct themselves in the workplace, and then eventually graduate and purchase their own home. So there's more of a celebration. So to provide those services, we're developers. We don't specialize in those supportive services. So working with quality nonprofits that have aligned interest with us in our projects is very important, and that's key, whether it's a standard affordable project or even more so a supportive project. So, we're working with a Pinellas County-based nonprofit, for example, and they're a great example because they conduct a lot of the services internally on their own, and then things that they can't, they're going to go out and work with other nonprofit third-party providers. So oftentimes with some of these funding sources, you have to have a nonprofit component to it. We're not looking for the nonprofit just to kind of check the box. Hey, you have a nonprofit partner that's involved here. We want to make sure that they're willing and capable and able to provide the supportive services of our projects. So that's what's important for us,
Awesome.
as aligned partners.
Great. Thank you so much to everybody. Unfortunately, we don't have time for audience Q&A. I will say I see a comment here in the chat about, sober living homes taking people who are on medication assisted treatment and what that looks like, because that's, we see more sober living residences leaning that direction. But it's a hard thing to figure out for folks on how to manage that. And because it's like a whole different ball game. But yeah, absolutely, harm reduction strategies are critical when we're looking at housing. Again, how to screen people in and not out when someone's trying to, live out their recovery journey. For them, how can we, support that? So I'm going to turn it over to Kelly. Thanks for having me.
Yes, thank you so much. So thank you to our moderator, Amanda Rosado, our panelists, Patrick Slattery, Michael Allen, Antonio Bird, and to William Atkinson for sharing his story of recovery today. And thank you all for joining us today. We know that access to housing is an essential piece in sustaining long-term recovery. So by implementing some of the strategies we discussed today, we hope to provide ways we can work together to create solutions that promote accessible housing options to all. It's our hope that we've reinvigorated and re-energized the housing conversation here today, and that we will use the topics discussed as a springboard into solutions we can all take back to our respective organizations. Thank you all for attending with us today, and we hope to see you at our next Link Lunch and Learn. It'll be on December 13th at 11:30 a.m. So we will see you then. Thank you.